This is the Talk Time segment. At a public lecture organized by the Federal Neuropsychiatric Hospital in Enugu, a former federal minister said about 64 million Nigerians suffer from mental illness. The former minister, Chinedu Nebo, also blamed the government of not doing enough to make people aware of mental health. Mental health is what we are discussing this morning, like I told you earlier, with a clinical psychiatrist, Dr. Olusegun Akinwotu. Thank you for joining us in the studio at this time. Thank you. And of course, he's also the Senior Registrar of Federal Neuropsychiatry Hospital and second Vice Chairman of Nigerian Medical Association. Again. All right, now, mental health is something that pretty much Nigerians still find it difficult to understand. Could you explain it to us?
Mental health has to do with the way we think, the way we feel, and all this together affects the way we talk and then our actions. So basically we say there is no health without mental health because it's a major component of definition of what health is.
All right, so when there is a mental ill health or illness, really, what does this connote?
Mental illness is a deviation from the normal because a stable mental health enables someone to function properly. You are able to carry out your daily activities, you are able to interact with other people, and at the same time, do whatever you're supposed to do to ensure that everything is practically going well. However, in the state of mental illness, there are some kind of manifestations in the individual which actually comes from the brain. And basically, it's more like a neuropsychiatric illness. That is, neuro is the brain and is functioning, and then psychiatric is the mental manifestations of that's practical manifestations of this. So in that sense, when these disorders occur, they manifest in various ways in form of the way the person acts, the way the person feels, and the way the person talks. So all this put together actually, make people begin to see. Someone who used to talk normally, you say something to the person and then the response is different. Somebody who is normal, that is euthymic, has a normal emotional state, interacts with you, all of a sudden becomes withdrawn. In cases, for example, like depression. And some, they have what we call formal thought disorder. That is, they have some kind of delusions. They have false beliefs. False beliefs that some people are after their lives.
Like
so
paranoia.
That now, they become paranoid. So that guides how they behave. So it is a thought process that now initiates the kind of actions that is their own response to these actions. All right.
Okay, so according to Dr. Chinedu Nebo, during a lecture he delivered at Enugu reading, he said that 64 million Nigerians have mental illness, one form of mental illness or another. How true or close to truth is this?
Well, that may not be untrue in the sense that, though I don't know his reference, however, most people with mental illnesses, considering the environment we are in, the environment we are in is besieged with a lot of stigma, and a lot of people believe anything related to such illness is practically either due to an evil spirit or somebody is being punished for a kind of offense against some gods. So because of our kind of belief and perception about mental illness, most people don't present to the hospitals or specialists who are actually experienced enough to be able to diagnose them and actually treat them. So basically, most of those you see are like probably less than 10% of those who have the illness. And if those who are like 10% of those who have this illness are the ones presenting to healthcare service areas where we have these statistics taken most of the time. Generally, prevalence in Nigeria is 20%.
Okay.
So if we say we are 160 million, you could extrapolate what that is. However, because majority of those who have this illness do not present, we don't see them. And even when you do community, research, you go and do community-based research, some will avoid volunteering certain information that they won't even want to, let you attend to them. So you may not be able to have the real figures based on what we are, like you said, on general note, it's like 20%. However, if the real figures were to be, assessed, it may be something a bit close to that.
All right, now you said something really that about public perception that the causes, usual causes of mental illness is supernatural attack or cultic attack, really somehow. So they tend to want to go and seek traditional help.
I didn't say that.
Right.
I
You
said
they tend to go and seek traditional help.
in our environment.
All right.
The perception is that this is due to some form of spiritual attack.
Some form of...
Yes,
all right.
that's perception.
Saying. Perception.
But the truth is, it's a biological illness.
That
it's
was
an illness
exactly
like
hypertension. That was what I said.
Okay.
I said, you said that people tend to believe that the causes. That was what I said.
Yeah. So I thought you said that was... that was
no, I said people tend to. You said people tend to believe. Okay,
It's,
so that aside, are we going to say that is the reason that Nigerians now tend to want to think... when you say they have mental illness, they think about psychotic kind of illness, really, general madness.
Yes.
Because can you tell us really if mental illness is just only that?
No, mental illness is not just not just psychotic disorders. There are mood disorders. There are substance use disorders, and then there are also anxiety disorders. There are some people who drive, when they drive on the road, they can't accelerate more than 60 kilometers per hour. Anything beyond that, they begin to tremble. Some have agoraphobia.
What's that?
You understand? Fear of heights. You understand? And then some have fears of various kind of things. Some are situational, some are generalized. That is, you can't really say this is a particular stimulus generating this anxiety. However, there are some that are specific. Particularly, maybe they have fear of talking, yes, hydrophobia, fear of talking in open places, things like that. They just, you put them on the stage and as if they want to enter into the floor.
And then people seeing such a person would think the person has issues. Okay.
So those are the kind of things that may happen. Then it's a spectrum from children to adults. In the very, very young, there are a number of conditions that are related to the way the brain is. For example, we have ADHD, attention deficit hyperactive disorder. We have autism. Children with autism actually are not able to interact socially with people. The speech is not properly developed, and then they have stereotypic behaviors.
They're always withdrawn as well.
Sorry?
They are always withdrawn?
Most of the time, they're withdrawn. They want to play by themselves. When they're other kids, even when they're 5, 6, and children are supposed to be playing together, they want to be on their own, and they have particular things they want to play with. So most parents begin to worry that what exactly is happening. And then there are other kind of illnesses, other kind of conditions. We have what they call Down syndrome. There are some psychiatric components in this. There's a higher, prevalence of some psychiatric conditions in children with Down syndrome. So these are, initially people will think, oh, it's a spiritual thing. But we want to enlighten the public. That's what I think the minister was saying, that the government hasn't enlightened the public enough. And the government has not allocated enough. Because
we'll get to that. Really, we just want to make sense of it first of all before we now go.
Those are the areas, and then as I said, the spectrum from childhood disorders to the other spectrum, that's
genetic
elderly.
Composition in early development.
Yes.
Okay, and then of course neurological and psychological experiences. No, I want to ask about, apart from these ones that you just mentioned under these categories, there's one here that is just called environmental stress and leads to mental illness as well.
What we've observed is that it's not just the environmental stress that brings about the development or manifestation of a mental illness or mental disorder. Some people have a genetic predisposition. There's it's been observed that some particular people have the predisposition. That's the makeup. If you take some genes in some parts of the body, it will likely replicate itself in other people who have similar genes. And when they face this particular stress, those who don't have those genes that are predisposed to this mental illness are less likely to come down with the mental illness. So the person's makeup on its own, that's why there are some studies that have shown that some mental illness as high as 60 to 70% is familial, that is genetic.
Genetic,
yes.
Oh, wow. So what about the neurological aspect of it? That should be mental, the psychotic kind of...
Neurologic is the brain itself and the spinal cord. Okay. And those are the areas that, you need for coordination, thinking, your thought, your speech, and the rest of that.
All right, now, so talking about, going back to environmental stress, really, we know we are in Lagos and we know the kind of stress almost everything brings. And then, of course, Professor Chinedu Nebo noticed something about it as well, that there are conditions, the modern day conditions in the everyday life now that somehow predisposes people to being stressed, really, that everything is just stressful, and that could really hamper on the performance of an individual, and then, of course, limit the person's performance neurologically or otherwise.
Oh, yeah. When we look at Lagos, for example, it's an urban environment, and then we have a lot of rapid development, and there is a lot of noise. There are a lot of factories therein, and then in this country, we have less of power generated, so people use generators. So all these things actually constitute what they do. And then there's traffic, you understand, you spend long hours trying to get to work, and then people are trying to ensure that they make ends meet. And there's, wake up early as 4 a.m., you need to get to work, you need to be at work by 7 a.m., and then sometimes you close as late as 10 p.m. You don't get home till 12 midnight. We need to rest. The brain needs rest. Rest is important. And that's why sleep is a kind of prelude into an episode of mental illness. And it's also a component of symptoms of mental illness. Those who are deprived of sleep and have the predisposition to have mental illness are likely to develop it as soon as sleep is deprived for a period of 3-4 days. I know a lady I attended to in March, a client who she finished new NYC. She wanted to do a training for front desk officer. There's this recruitment agency. So they put together, I think, about 600 people who apply to be trained, and then they send them to who needs them. Eventually, just 1 week, she was staying in the Ikorodu. The training was in Yaba. She wakes up as early as 4 to be able to make it there at 7. You must resume there at 7, or else they won't attend to you for the day. They will say you can't come in for that day. And then they close by 7 p.m. Before she gets back to Ikorodu, it's almost 12 midnight. She did it just for a week. By the next Sunday, she broke down.
Wow.
She was talking, just all of a sudden, the auntie she went to the uncle's room, and somebody who doesn't usually enter the uncle's room, sat on the bed, and then when they say something else, she says something else. And all of a sudden, she started screaming. She broke down because she wasn't sleeping. And she actually accepted that the last 3 days, there was no sleep at all, because she's thinking she won't wake up early to be able to make up the training. So we need to, have time for rest. We need to ensure that the body doesn't suffer certain things. Then we need to also, create time to go on vacation. You can't work around the year, 12 months, and not take a vacation. You need to do that. You need to take good care of yourself.
If they can't afford it, really.
No, vacation doesn't really need traveling out. You could just take your leave and stay in your home, and probably a weekend around, you can go to your hometown. When you go to the hometown, there is less stress. There is less traffic, there's less noise, and then the air is clearer. All these pollutions we bring out are sources of stress.
Gas emissions.
Yes, gas emissions. We may not acknowledge, because they are not really disturbing directly, but for those who are very sensitive, you see them sneezing and responding in one way or the other. All these have a way of adding to the stress we have in this country.
And then a doctor as well, in 2014, just last year, Dr. Femi Olugbile said that practically around 90% of patients with mental illness fail to go to the hospital for either treatment or to even get diagnosed.
Yes.
So how huge is that for a country like Nigeria?
It is. Earlier I said less than 10% are the ones we see. So you can see that corroborates. The other is the 90% is saying now that 90% are the ones that 90% don't show up. So if that is the case, it's a very big problem, because they stay away from the health center where they could get help, and they become a risk to themselves. First, because some may have some auditory sensations, which we call hallucinations. They hear voices telling them to kill themselves. Some hear voices telling them to run in front of a trailer. You understand? Or
so that's one of the causes for increased number of suicides being recorded.
Yes.
Oh.
It will be responsible for that. And even with other forms of mental illness where they feel they feel tired of life, as in there's no hope for them, then what else? Or, you see, recently, some years ago, 3 or 4 years ago, there was, I think, a prominent Nigerian, I don't know if it was from the Senate, who had some loan problems. He was coming and then he jumped into the lagoon, by, I think, on Eco Bridge. Those are issues. Those are the things. He probably had a loan he couldn't pay. But all we heard was he left the bank. So we don't know what the manager told him.
Indeed.
So those are, you just felt, I don't think I can cope with this. Maybe they said he has to go and sell all his house and come and pay. So when those kind of pressures come, then when we talk about environmental stress, those stresses are not just things in the environment. There are things like a loss of a loved one, loss of a property, you lose your job. Those are things that can bring down mental breakdown. So we need to ensure that we buffer a lot of things. Buffering includes improving the state of the nation. Buffering includes you providing adequate jobs for people, ensuring there's basic needs of life. And then for those who can't afford to get job for now, there should be a kind of welfare package that takes care of the youth so that they don't, begin to go around trying to do all sort of vices to get funds, money for themselves. And that also, when they are not really engaged, it gives them the opportunity to start smoking cannabis, which is on the increase now. Substance abuse is a major problem in the country now. And then also use of cocaine, heroin, and the likes. Substance addiction, it's a big problem in the country. So these are things that brings about a range of the manifestations of psychiatric disorders.
All right, so talking about government now doing something for psychiatric system in the country, because we know that the medical, I don't even want to say mental health, really. Right. Okay, how many psychiatry hospitals do we even have in Nigeria? Are they enough?
We see, in terms of resources, both material and human, it's inadequate. We have less mental health doctors, psychiatrists. I think we're not having up to 170.
Are you up to one? Because as at 2014, Dr. Lugbe was saying we're just about 100 or so.
No. As at 2012, we're 150, and doctors have added.
And most of the time they practice abroad, they come back home.
We have new ones who have graduated. But the point is, because of poor state of remuneration, psychiatrists are hot cake in other parts of the world. And because of that, many of them want to migrate. As soon as they are finishing residency, which makes you a specialist, you're thinking of going to Canada, because they realize that Canada doesn't have a lot of hurdles like UK and the US. And then even those who also they try the UK. Those who still want to do PLAB, they go to the UK. And those who can do USMLE, they go to US. And once they realize, look, you're already a consultant. Nigeria has invested in you. You're already a baked cake.
They take that
they take you there, and then you earn your...
And then the country is still at the same level. All right, we'll talk more about this. We have Ogaba joining us, however, this time. Good morning to you, Ogaba. Go ahead with your comments.
Morning, my sister Aziza. And regards to your to the doctor in the house. Doctor, it's nice to have you this morning because you see, I think your sector is one of, just like you said, a mental health is paramount in a person's life, because if you don't have it, it means you don't have health at all. I think that your organization or the area of your profession is very, 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 very crucial to our country at this time. You look at on our roads, even in our politics, you see people misbehaving and doing all sorts of things. Your organization should work closely with the government of the day to really ascertain who is mentally healthy and who is not. you should be at the front of, trying to sanitize this country. If not, I don't see how we can really organize ourselves because of the high level of distortions in our society today. Thank you very much, and God continue to bless.
Thank you, Ogaba, for that contribution. And from what Ogaba said, really, the thing, because I hear that one of the implications of mental illness is that such patients could underperform and then even make wrong decisions.
Exactly.
So imagine if such person is at the helm of affairs of a country or a state or a local government.
That's it. You see, it's important that people who go into such offices have proper mental stability, because mental illness, as we said, is a disorder of the thinking process, and which also affects your actions. So if you have a disordered thinking pattern, likely your actions will be impaired, your judgment will be impaired. And if you're taking decisions for people as many as 160 million like we have in Nigeria, or like a state of 12 million people, and you're making impaired decisions, then it's going to affect the lives of people. So it is important that those who go into such offices have proper evaluation, and that they can actually eventually do what is best for the nation.
All right. Okay. Is this statement really that at least 1 in 5 people sometime in their life would experience a mental illness, one form of mental illness or another? Is that close to truth?
Well, from the prevalence we've mentioned, I think that is likely to be true, because current prevalence is 20%, which is 1 in 5 already. So it's possible that happens.
All right, we have Messiah calling us at this time. Good morning to you. Oh, apologies for not picking your call quite soon enough. I totally apologize. So please call, excuse me, please call back. I'll be expecting your call. I promise to pick your call as soon as I get such info from my director to do so that you're back on the line. Thank you for watching the program. Please call back. But in the meantime, if you still want to call us, reduce the volume of your TV set, step away from it so you can make a healthy contribution to what we are talking about, mental health in Nigeria at this time. So, okay, so there's different conditions now. What is the treatment process like?
The treatment process is like every other illness. You bring the patient to the hospital. Please, when people begin to behave in an unusual manner, this is somebody you used to know his prior personality states, and all of a sudden he begins to behave in a particular way.
Apologies, we have another caller. Nasir, good morning to you. Nasir, right?
Yeah, good morning, Aziza.
Okay, yeah. Your comment now.
Yeah.
Nasir. Oh, I would love to end your call, Nasir. So sorry for that. I just appealed to everyone to please reduce the volume of their TV sets before calling. I could barely hear what you said anyway when you were talking to me. So please reduce the volume of your TV set and then call back. You can step away from it so we can hear you. It won't be nice for you to waste your call credit and then you won't even communicate. Thank you as you do so, and that goes to other potential callers on the show. Thank you very much. All right, the possible treatments.
Yes, so possible treatments, like other illnesses, like I said earlier, is people present to the hospital, and then doctors who are available will assess them, make a diagnosis, and treatments available include pharmacological, which is use of drugs, and psychological intervention, social intervention, and all these form a kind of holistic package in ensuring that the patients are properly treated. And those who present early have better prognosis. So we want to dissuade, at least try to encourage people to present early to the hospitals. By the time somebody has such illnesses and you just keep them in the church, mosque, or some other forms of spiritual houses, you're going to be delaying the time they need to get treatment. And that gives us what we call long duration of untreated psychosis,
All right, well,
which is a poor prognostic factor.
That is a psychotic kind of mental illness,
Any
right?
form.
Any form.
Any
But
form
how
of-
do people know the other form of mental illness if they have it or their loved ones have it? Before you say anything, let's pick Richard's call. Good morning to you, Richard. Richard, are you still there?
Yes, I'm still there, man. Good morning, man.
Good morning.
Yes. I want to ask doctor a question.
Go ahead.
My question is that I have a baby of 1 year, 6 months now, and he could not talk. So how do we be of help to such a child? We discovered that the head was very small. So we noticed that, and, how can we be of help to such a child? Or what has happened, and how do we correct it?
All right, did you get the question?
I got the question. Some children present with delayed developmental milestones. These are the hallmarks. Some fail to be able to control their neck at the required age. They cannot sit on their own by a particular age. Like he said, 1 year and 6 months, supposed to. Anyway, the speech is not as formed by that age. What we just say, if he says the head is small, I think they should present at the hospital. In Lagos here, we have the Federal Neuropsychiatric Hospital, Oshodi Annex. That's the Child and Adolescent Center, mainly there to take care of children who have such kind of presentation. So when they come, the doctor will assess, and if truly there is something that's some form of impaired speech, we have speech therapists in that area. Now, this will give me the opportunity to also say that there is a more comprehensive team managing children. For adults, you may not really need the speech therapist. For the adults, you may not really need the physiotherapist. For some children who have, delayed developmental milestones, which some, generally call some form of maybe cerebral palsy, that is the brain hasn't formed well, and then they cannot talk as they are supposed to. They are not able to hold things when they are supposed to grip, and they can't even stand or sit by themselves. We are able to do some form of therapy for them to improve their quality of life. We get the speech therapists to put them through some processes that makes them able to make some pronunciations, and then also the psychotherapy, when they get a bit older, the psychologist is there, and then the physiotherapist is also there. And then there are some skills they need to learn, which the occupational therapist will also assist them with. So we have the center, the Child and Adolescent Center. And then related to the previous caller who talked about those who are in position of authority, the APN, that is Association of Psychiatric Conference, comes up at the end of October. And it's mainly talking about mental health as a driver for change. You understand? So we are looking at how this can bring about positive change in our country. So that event is October 25th to 30th. Because
sometimes you wonder why people do some things they do, like a driver driving against traffic, leaving the road for him and going to the other route. So you wonder, really, and then someone beats in traffic, little things like that. So it brings me to the question I asked earlier. How do people get to identify that what they are experiencing at the time could be mental illness, or be able to determine if their loved ones are having such the problem at that time, and be able to take them to the psychiatric hospital for help? Before you say anything, let's pick Aliu's call. Good morning to you, Aliu. Thank you for calling. Go ahead.
Good morning. How are you?
Fine.
I want to contribute to the program. Hello?
Yes, go ahead. We are listening.
So what I'm saying, I said when I'm watching the program, what you are saying is maybe people going to the office, but it should be a general exercise on everybody, particularly when you are handling life. We have drivers, we have people that are operating in the factory, there are a lot of things. So let this test of a mental ability should be a routine something. Maybe you should have an update. You see, like there are other programs when we're talking about maybe water. I'm an expert in water engineer. We do a routine test of our water to see the quality of this product, so that at least it won't affect the consumers. So even human being that is dealing with public, you have a routine test, not maybe when he's coming into office. Let there be an update that you have maybe a history of your maybe an interval of this time, you do this test, you keep it, the record should be there, so that at least the doctor can compare and know if there's any problem along the line. I think that's my own contribution. Let it not be, okay, when you are coming into office, other people, like drivers, you know, a lot of things, we have teachers, you know, so let's be kind of a culture in the country so that at least it will help in keeping records. And there will be a history of an individual based on that aspect. Thank you.
All right, thank you very much, Ali. Well, we never said that it's just for office people alone. Anybody, any human being, both adults or children, could, of course, be predisposed to mental illness. So it's not just for those that are working in offices, really. I just mentioned that drivers driving against traffic, that you would wonder why some people do what they do. So it's not just about people working in offices. And of course, we talked about people controlling big companies or so states, even nations, really, or local governments. So it's generalized. Anyone, of course, can have mental health, especially with the statement which says that at least 1 in 5 people in a lifetime could sometime experience one form of mental illness or another. So I'm back to the question I asked earlier.
Can I say something about what he said? I think what he's trying to say is routinely, it's only those who are probably seeking employment for officers, that's in work in an office, that the company says go and do this assessment, and that this should not just be restricted to those who want to work somewhere or applying for jobs for one form of employment or the other. He believes that we should spread it out. If you're going to be working as a motor park driver, there should be some time as a regular routine checks which involve psychiatric evaluation for those who are likely to be drivers. Then if you're also going to be an engineer that, you know, would need to do certain things, you need to have such evaluation. That's just saying generally that general public should have some form of evaluation at one point of their lives or the other. Okay,
back to that question. Well, again, we have to pick another call. Gospel is calling from, I didn't get the state, but just go ahead.
Good morning, doctor.
Good morning. It's greeting you. Gospel, please reduce the volume of your TV set. That was quite loud. Oh, it seems we've lost Gospel's call. Call back, but please reduce the volume of your TV. That was very loud. It was too loud. It was even louder than your voice. Please reduce the volume of your TV and then call back, Gospel. Thank you for your call. Anyway, I'm sure I wanted to ask you a question. I hope he calls back before the end of the program. Yes, it's an opportunity for you anyway to talk to ask one question or another from Dr. Akinwotu before he leaves the program today, especially to make sense of some of these things. So how can people identify that this is mental health? Let me seek
okay, there are some sort of insidious manifestations. They start gradually. There's what we call personality disorder. That's people who have already attained the age of 18. For example, you begin to see that, you know, ordinarily he was friendly, jovial, and this guy begins to just keep to himself. Friends used to come to look for him. Even when they come now, he says he doesn't want to see them. And at some point, he may just decide, today I'm not coming out of my room. And then he has this odd behavior, you know. So there are various forms of personality disorders. That's a spectrum on its own. Then there are those that are related to more psychotic disorders. And when you see the person on its own, sometimes there is nobody with the person, but the person talks as if he's talking, there's somebody else there. And then that's the hallucinating experience. And then the actions, you know, the person begins, okay, we are going to eat now, let's serve the food. And he says, no, I'm not eating with you. Like a young boy I attended to, like I think 2 weeks ago, he just suddenly they bought, I think, puff puff, like they usually buy for other kids, like 7 of them. And he said, no, nobody should eat it, that it's been poisoned. And he said, kept saying, no, please don't kill me, I don't want to die yet, just all of a sudden. So these are things, immediately the parent, I was very happy about that. And I think I saw him 2 days ago. Calm.
He's improving now.
And he's using his drugs now.
Okay, we have Ignatius calling us. Good morning from Bene? Oh, Cameroon, rather. Good morning to you. Go ahead.
Yeah, good morning, my sister. Yes. I just want to contribute for this program. You know, one thing, people have said about mental problem in Nigeria. The only thing that you people can do now is to start acting on it by avoiding people to smoking in their hands. Because that is one of the contributions.
Oh, it seems the network is somehow bad, but your TV was loud as well. But thank you. We got what you were trying to say, Ignatius, that smoking of cannabis and of course can also hamper mental health. Anyway, so you were making the point earlier about possible
some symptoms. And then some that's related to that. And then in the older group, which I didn't get to earlier, we have some, you know, some kind of illnesses, but the commonest of them are dementias. You know, all of a sudden, the old person begins to, they get to forget things. They forget their way around the house at times, or they put their money somewhere, and they keep accusing people around us, okay, somebody has stolen my money, even despite probably she locked her room, and she was the only one that had the key. So that's, you know, the memory begins to, you know,
and that's common really with old people. And, say, I'm looking for my key, yet the key is in their pockets. I've seen some old people.
And some manifest with some other symptoms, which we call behavioral disorders in dementia. Some are also hallucinate. They become easily irritable. They may be apathetic, and at that point they get sometimes aggressive and begin to, you know, have some other forms of delusion, most of which, key of which may be paranoid delusion, that people are against them. And they probably keep, you know, just getting angry with the kids, because most of them probably are staying with their children. And the children begin to wonder, Mommy, what's causing this? So once they observe such, it's important they, you know, present to the hospital. And then there are ways, we all know our kids, you know, those who start, the teenagers mainly.
Apologies, doctor. Let's pick a Kudu's call. Oh, apologies to you, Kudu. So sorry that I couldn't talk to you. Please call back. From this point, once that my director tells me a caller is on the line, I just pick the call. It's just that it wouldn't be nice, you know, to keep cutting the doctor mid-sentences. But thank you very much for calling anyway. Please call back before we round off this segment of the show. Kudu from Niger State. All right, you can continue now.
Yeah, so amongst the adolescents and the young people, most of the common conditions are related to substance abuse. That's like the last caller who talked about we should ban use of cannabis. It's on the rampant rates at the moment.
All right, doctor, we have a Gospel calling back. Gospel, go ahead now.
Yes, good morning, doctor.
Good morning.
Yes, I was the one that asked question earlier about my child that was 1 year, 6 months, and he could not talk. Initially, when we discovered the head was small, he had some challenges initially. He could not walk, he could not drink something, but he has overcome that. He's running up and down now. And he's calling Mama, Papa, Mama, Papa. But one symptom we saw now is that he's not concentrating on one thing. He will grab one thing and drop it. He will run to this side, run to this side. It's not so. We are planning to put him in school by September, but taking him to school with that kind of behavior, he will not settle down in the class to concentrate. So how do we be of help to him? I say in Togo precisely, you talk about one hospital in Lagos here, Oshodi. How can I be able to help myself down to Oshodi and all of that? Is there any advice that you could give me here so that to be of help to him, and how could that be faster to overcome other challenges that is not seen?
All right, I think that's the question.
All right. Thank you very much. You just talked about some symptoms. I mentioned of ADHD earlier, attention deficit hyperactive disorder. Well, I don't want to be presumptuous because there are other components. The child is hyperactive, inattentive, can't focus sometime on one thing for a long time. And sometimes when you're talking to them as if they're not listening to you, and in addition, they're also impulsive. Impulsive just acts, you know, sometimes without, you know, you wondering what exactly has just happened, you know. You keep them, they're supposed to be on the queue with other kids. They want to jump and go to the front. They want to climb tables every time and all that. So, as I said, it's still important it presents to the hospital for proper assessment and evaluation. And, okay, if it's a kind of growing up thing, that, okay, it's a child is growing up, it's a normal kind of play, you'll be able to assess that. And if it's beyond the normal kind of play, it's important that the doctor is able to make the assessment early so they can place him on some kind of treatment to ensure that he is able to cope in class and then also behave well at home.
All right, you mentioned something about the hospital you talked about earlier as well at Oshodi, but would it be advisable for him to come?
Yes, yes. The hospital is at on Nitel Road. Nitel Road, that's the Child and Adolescent Center by the back gates of NAFDAC.
In Lagos,
Just, yes. Oshodi, yes. Nitel Road.
Okay.
Yes. More like that road between from Oshodi going to Mushin, going to Vonu.
Oh, okay.
Yes.
All right.
The first turning on the right.
All right.
Yeah, the first turning on the right. That's the Child and Adolescent Center.
But definitely they should have in every state, right, in the country?
You see, child and adolescent is a subspecialty in psychiatry. That's why even mental health centers are not adequate. That is where you see general psychiatry, adult, and you know, the likes. So very few centers have this sub-discipline. I think Ibadan, Lagos are the ones that are most prominent.
All right, because I feel for gospel, and I think he's so concerned about his word. Can I leave your card with my producer so that he can call back and then we call you to talk better?
No problem.
All right, so gospel, after the show, you can. He gave me a card, so I'll give it to my producer so you can call back, get the doctor's information, his phone number, so you can talk to him better, and then maybe if you want to come down like you're thinking, it would be better for you. Okay, so you can get information from the producer of TVC Breakfast after this show for whatever information you need about Dr. Akinwotu after the show. All right, we still have a few minutes anyway. I think it's just time to wrap up. Time is gone. Well, people have called. But anyway, so in essence, the need for mental health in Nigeria at this time?
Well, the need for mental health in Nigeria at this time, people need to be aware that these illnesses are not spiritual. The illnesses are medical and they have medical treatment. That is, they can be managed. There are some, you see, mental illness, like hypertension, like asthma, like diabetes, are chronic illnesses. So chronic illnesses are managed for a period of time. The blood pressure is controlled. The symptoms of mental illness can also be controlled. And then the person lives a normal life, goes to work like every other person. And then we also want to encourage the government. The government needs to do a lot. The Mental Health Act has not been passed. And even the health bill itself is still hanging, not to now talk of the Mental Health Act, which actually will go a long way in opening a lot of channels to ensure that, you see, these people we see on the road, we call them vagrants, who just, you see, they are not wearing clothes, they move about dustbins, pick things, and they are at risk to themselves because they are picking from the garbage. And then they also could be hit by, you see some dead bodies on the road because they are not actually fully in tune with reality. So they are not even bothered that the car is coming towards them. You get it? So if that law is passed, then a lot of allocation, funds will be made available, and then the healthcare providers will be empowered to use the available security to take them off the roads, and then we cater for them with government expenditure. But this is not being passed. So funds are not yet allocated for this kind of acts. And then, you see, someone who's having mental health is not in full control of his or herself. So cannot really take decision that you, like somebody who comes to the hospital, have malaria, we're going to admit you. No, I don't want to be admitted. Please, just give me drugs. I'll go home. When somebody who has attempted to stab himself or somebody in a house will now come to the hospital and says he doesn't want to be admitted, how do you go about that? You must compulsorily admit that person. So the law needs to be available to back the doctors, the nurses, the psychologists to do this treatment to ensure that the country is a better place for everyone. And then we also clamor for more allocation to the health sector to ensure that, you know, the facilities that are required are adequate to ensure that patients are properly managed.
Anyway, President Muhammadu Buhari, during his electioneering campaign, promised to give attention to the health sector, so we hope this happens pretty soon. Thank you very much, Dr. Olusegun Akinwotu, Senior Registrar, Federal Neuropsychiatric Hospital.
Very much, madam.
All right, that's it on the Talk Time segment of the show.